ablation. So the nitric oxide is not free in the bloodstream, but is a radical, and it binds to a complex, to hemoglobin. And using the blue laser, the nitric oxide will be dissociated from the hemoglobin and immediately opens up the circulation. Yeah, in the brain, in the heart, in kidney, everywhere in the body. So it's a very important laser especially for cardiovascular diseases. Okay, stop it, and we go to the next one. We go to the yellow laser. The yellow laser is a new one. It looks like gold. Many doctors call it golden laser. And it has really a golden effect. The yellow laser was very difficult to manufacture because it takes a lot of energy and the model becomes hot. So we have a new model here with an integrated fan cooling. And now it's very stable. So I connect the yellow laser to my catheter. And you can see a tiny spot here of yellow light here. Yeah? So you see the difference between the lasers on the different blood cells. The question is, what is the yellow laser doing? The yellow laser is something which brings more serotonin in the bloodstream, so it has a huge antidepressive effect. It has a detoxification effect. It brings happiness into the body, and people can sleep better because they have more melatonin. So we stop.
This is the best access of injections inside the knee. Some doctors use also the inner side, but I prefer the outside of the knee. So you see I marked already the area where I want to puncture the knee. Injection there normally is easy and quickly done. In the first step now we give a local anesthesia. So we can use maybe scandicaine or xylocaine or procaine. We give a small injection inside the skin, and then under injection I move the needle forward and back to give a good local anesthesia of the injection channel. In the next step, now we put the granula in the injection place in an angle of about 45 degrees, and you see it's easy and you feel it when it moves through the capsula of the knee. So the next step is now injection of hyaluronic acid. Of course, you can also use other drugs for regeneration of cartilage. Some doctors also work with own serum of patients. It is very important that you are feeling that the injection is very easy. If there is a bigger resistance during the injection, then you might have a wrong place, maybe in the Hoffa fat body or in the connective tissue, and then the injection could be painful and should not be performed completely. But you see here injection is very easy, no big resistance in the syringe. So the hyaluronic acid now is injected in the knee, and we remove the syringe now, and now we insert the sterile catheter directly in the granula. Sometimes we have to turn it a little bit. You see now it goes in, and by turning the screw now we have a complete closed system. So you see the end of the plastic fiber optic catheter, which is now placed directly inside the knee. We have a look on the device now on the touch screen. So normally we treat the chronic osteoarthritis with red and infrared laser because we have the best. We have a look on the device now on the touch screen. So normally we treat the chronic osteoarthritis with red and infrared laser, because we have the best literature and the best results with those lasers. On the other hand, if the knee is more inflamed, maybe in rheumatism, then it might be better to give only the blue laser, because the blue laser has better anti-inflammatory effect. So you see, I press the red laser, and then I switch the device on and connect the orange fiber optic cable with a special adapter with the end of the catheter. And the light is coupled then from the fiber optics directly into the catheter. Very important that there's a good fiber coupling, because the diameter of the fiber optics is only 0.4 millimeter. So we switch on the red light, we connect. We can see the red light going through the plastic cable, and now we fix with the tape the cable on the knee. And you see now the light is going directly inside the knee. And if we switch now the light off, you can see exactly the spreading of the red light in the whole inner side of the knee. It's an amazing effect for the therapist and also the patient. In contrast to only injection of hyaluronic acid, this therapy is extremely effective. So now I would like to present you the new developed fiber optic needles for interstitial and intra-articular therapy. These cannulas are so-called fiber optic cannulas because a laser catheter from plastic material is already inserted in the needle, and the top of the catheter is placed right in the end of the needle. So for different treatment options, we developed fiber optic needles with different lengths, starting from 4 to 6 to 8 to 10 up to a maximum of 12 centimeters. A second development is fiber optic needles with an additional three-way connector. That means we can not only puncture a pathology maybe on the spine or in the joint, but we can also additionally inject directly in the fiber optic needles maybe local anesthesia or different drugs for pain or maybe anti-inflammatory effects. You see that I switched on now the red laser, and that the red laser is coming out of the end of the fiber optic needles. I will now demonstrate the three-way connector needle. I connect first the green laser. You see the green light coming out of the top of the needle, and in the next step I can inject through the fiber optic needle another fluid, maybe local anesthesia or anything else what I want. I have now a patient with disc prolapse in the area L5S1. The big difference to a treatment from outside is that the skin normally absorbs already 80% of the light, and nobody knows how much light, or maybe if any, will reach the pathology in the depth of the tissue. That was one of the biggest problems of laser therapy in the past. But we are now able to bring any laser light of any color, infrared, red, green, blue, or any other, directly by the fiber optic in the needle a little bit to the origin of it disappears from the top of the needle. And now I go in the next step now, without any pain of the patient, now I will now close to the pathology, insert the fiber optic needles. I pull the catheter in the needle a little bit back, that it disappears from the top of the needle, and now I go, without any pain of the patient now, close to the pathology, I asked him several times if he has pain or not, but he's okay. So now we have a penetration depth about 4 to 5 centimeters, and the patient is not very thick and has not big muscles, so with 4 or 5 centimeters we are close enough to the disc prolapse area. I will now connect my laser, and in the first step we give a red laser to improve the microcirculation in the area and also initiate a regenerating effect on the nerve tissue. Also, we will have a spasmolytic effect of the red laser on the muscle, and we can decrease the muscle tension, which leads immediately after the treatment normally to a massive pain relief. So, beside of the local anesthesia, this therapy is absolutely pain-free and free of any risk if the doctor is well educated in anatomy. And also we can avoid to inject any drugs like diclofenac or ibuprofen. We only give a little bit procaine, saline solution and a laser, so it's a very physiological therapy what we are applying here. So ask the patient now if he has pain. He says no, it's absolutely pain-free. You see, a patient is very quiet, and the big advantage is of this therapy that normally already after the first treatment or maybe the next day the patient has a lot of pain relief, so it is much more effective than only treatment with maybe with warmth or maybe with laser therapy or other methods from outside. We are direct now, very close on the roots of the nerve, and so we can treat with high efficacy disc prolapse, spinal stenosis, or facet syndromes.
Dear colleagues, my name is Dr. Michael Weber from Germany. Today I want to show you the so-called interstitial photodynamic therapy of a breast cancer patient. This is our patient. Her name is Susanna. She comes from Prague and she's 52 years old. Her history in short, she found a node in her right breast about 2 years ago, but she did not do anything. She rejected chemotherapy operation. She only was treated with natural things like herbs and different other things. In November last year, she came to me for first treatment, and unfortunately she had a lot of problems with her brain, and 2 brain metastases were detected. She went to the University Clinic of Göttingen in December, and both metastases were removed successfully. But still the problem remains, the breast cancer, and the cancer was growing a lot. Galina, can you please move this? So just before this treatment, I'll show you the right breast, and I marked already the area what I have seen in the ultrasound check. And you see that here is already an ulceration area. And also we found about 5 lymph node metastases here in the axilla area. Okay. Susanna got liposomal indocyanine green photosensitizers 4 days ago. We're treating a breast already with external infrared laser therapy to stimulate the indocyanine green We're also treating her with therapeutic ultrasound, low-power ultrasound and also shockwave to activate the photosensitizer with laser light and also with ultrasound. Now, after 3-4 days, the photosensitizer is accumulated as a maximum in the tumor area, and I marked already the places where I want to put the needle inside. The problem in photodynamic therapy is that the laser what you apply from outside is absorbed in a high degree from the skin. The infrared laser, of course, has the best penetration, much better than red laser, but still there is an absorption of about 80% in the skin already. So if we want to reach the deeper layers of the tumor inside the body, is very difficult. We can solve this problem only if we give the needles interstitially. That means we put small fiber optic needles and fiber optic catheters about 1 centimeter deep into the tissue, very close to the tumor area, and then we irradiate inside the tissue interstitially. In the first step, we have now to sterilize the area and give a local anesthesia before we put the fiber optic needles inside. Okay. Normal sterilization with some alcohol. Okay. This is local anesthesia. We use scandicane, but also you can use lidocaine or something else. Okay? Mm-hmm. So I give the first injection. Is okay, Susanne?
Okay.
Okay. Give me a little bit for. Okay. Next one. And move forward and back and inject the local anesthesia. Okay. Clean a little bit, yeah. Okay. Next one. Is that okay?
Okay, okay.
Ah, she's a brave patient, I know. Never complaining. Last one. Okay. This is done now, and now we will wait for about 2 minutes till the local anesthesia is working, and then we will insert the fiber optic needles and connect them to our laser modules. For the treatment, we are using this laser device. It can be equipped with a total 12 laser modules, and we can use different colors. We are working with indocyanine green, which will be stimulated by infrared light. So we have 6 infrared laser modules on this device, and the laser coming out from the module will go into the optical fiber and comes out at the end of this fiber optics. So for the therapy, we will put these small butterflies with a length of about 2 centimeters right on top of the cancer, around the tumor, and we will put a sterile fiber optics inside, and this fiber is coming out at the end of the needle and will then be connected to the fiber optics of the device, so that the laser beam which is coming out of the laser module goes through this fiber, will then be inserted in the fiber optics and comes out on the top of the needle right into the tissue. So in the next step now we will put the fiber optic needles inside the body close to the tumor area. So I'll start with the first one here. Okay. Mm-hmm. It's not painful. If you have good local anesthesia, it's not a painful procedure. Next. Yeah. Okay, everything?
Okay.
Thank you, fine. So that's number 5, and the last one. So now all needles are set. I will now, in the next step, remove the closer caps and insert the sterile catheters. You see, it's really not a difficult procedure. Goes quite quick. The main thing is a good local anesthesia so that it's not a painful procedure for our patient. In the first step, I will treat the breast more from the upper side. In the second step, I will treat also from the downside. And in the third step, I will also treat the axilla area where she already has 5 lymph nodes. We marked them already in the ultrasound. So in such big tumors, sometimes we have to do it in several steps. Okay. So all needles are successfully inserted, and in the next step we will connect them with our infrared laser modules. Okay, you see this is the connection. Put it in the connector, put it in the right position and fix it with tape. That's good. Next one. So you see, it is not a difficult procedure, but believe me, it is very, very effective. And it's the only way to bring the laser light with a sufficient concentration into the body to achieve a maximum photodynamic effect. Oh, the last one. So, everything is ready now, and we switch the device on. We are working with infrared light, so this light is a non-visible light, so you cannot see anything on the screen, but we are treating each point with 100 milliwatt infrared laser, wavelength 810 nanometers interstitially. The light is coming out of a fiber optics in an angle of about 20 degrees, and the power per square centimeter, which is coming out of the end of the fiber, is very high. It's between 80 and 100 watt per square centimeter. Watt, not milliwatt. So it's a high amount of energy what we are giving in the area, and we can expect after some days that we can already see a reduction of tumor size. Thank you very much.
Now demonstrate you the treatment with laser needles in the face, on the ear and on the skull. You know, treatment of face and skull and ear is very effective in acupuncture, because especially in ear acupuncture the stimulation of the points and the nerve inputs are going directly and quickly in the brain. But we have a big problem, because, you know, on the skull we have hairs and we cannot fix with our well-known sticky discs. So we have to use a different technology. Also very interesting is the infrared laser on the skull, because the infrared laser can go through the bone transcranially and stimulate directly the brain, for example in stroke patients or Alzheimer's disease. We developed here the special patented Weber needle head adapter, which we can put on the skin, and by turning the button behind we can fix it in a comfortable position. I demonstrate you now how the needles are fixed on the so-called flexible wires. So at the end of this flexible wire we have small holes, small adapters, where I can put in the needle inside, and then I fix it in the upper part of the non-flexible wire. So you see now I have an instrument which carries the laser needle, which I can later put on the complicated structures in the face. I will demonstrate it first in the well-known point large intestine 20, what we can use for sinusitis, for example, or chronic rhinitis. You see that we have a lot of different plugins there. It is important that we always use the plugin which is placed exactly over the point what we have to treat. So you see I put in the plug of the flexible needle carrier over the point large intestine 20, and now I move the flexible wire with the carrying needle very close to the treatment point. Now I pull the green plastic back and the guiding wire forward, so the needle goes with a slight pressure directly on the treatment point. And you see the patient can move his head and the needle stays in place. So if I want to change to another place, you see I can move the flexible wire. I go with my needle close maybe to the extra point of the eye, and then I push my guidance wire, the metal one, forward, and I pull the green plastic back, and you see I have a wonderful fixing on the complicated structure of the face. Now I demonstrate you how effective we can treat with laser needles even on the complicated and difficult structure of the ears. You know, the whole human body is projected on the ears, so in the down part we have the head, and in the inner side we have the inner organs, and in the upper part we have the extremities like knees and legs and fingers and toes. So again I choose the plug-in which is placed directly over the treating point. You see I move my flexible wire close with the carry needle close to the treatment point. In this case I treat the Shenmeng point, and again I pull the green plastic over the metal small guidance wire back, and exactly I can fix the needle on the ear point. So I will change to another ear point. So maybe I go to the thalamus point, the main pain point on the ear, and again you see I pull the green plastic over the metal guidance wire back, and then I fix my needle on the acupuncture point. Of course this needs a little bit training, but it is a very nice technology, and the effects of this method on all pathologies are very quick. So with this technology I can even treat inside the ear. I can directly irradiate inside the ear, maybe for hearing loss or for treatment of tinnitus. So in a next step I will show you how to treat in the head area. This is normally quite difficult because of course it is very very difficult to fix needles between such dense black hairs what this patient has. So let's treat a point now on the government meridian, maybe the main point, government 20. So this is a very important point. So with this technology we treat pathologies like stroke patients, Alzheimer's or Parkinson's patients, or dementia. So again I choose the right plug-in on the side. So the cable is plugged in. I move my flexible wire with the needle at the end close to the treatment point. And now I pull again the green wire, the green plastic wire back over the metal guidance wire. And now you see I can treat exactly on the skull with the attached laser, even between black hairs. So I cannot only stimulate acupuncture points on the skull, on the different meridians like gallbladder or the government meridian. I also can treat effectively transcranially the inner structure of the brain. Of course, several people, they prefer more a lying position because it's more relaxing. So I will now demonstrate you how to work with this technology in a lying position. For this, Weber Medical has developed a special pillow where the head of the patient is lying, and we use now a different adapter so that it will not make any pressure on the neck if the patient is lying in the ring with his head. So the patient moves his head forward and will lie down now directly in the ring. Also for the therapists, it's a very comfortable position, of course, and many therapists are choosing the points maybe by pulse testing, and so you can do it in a very nice and relaxing position. Again, look here how we do it. We fix the needle here in the adapter. We fix it in the upper loop of the metal wire. We look again for the right plug-in, what is directly below the treatment point. We put the plug-in. Okay. We bring the needle in the right position by moving the flexible wire. And look here, we pull the green plastic back and move the metal small guidance wire forward, and we treat now exactly the ear point, the very nice relaxing position of the patient. So again we move to the thalamus point, easy to do. We go to the other point, change the position, push the metal wire forward and move the green plastic back. So in the same manner I can treat, of course, lateral points on the head, for example on the gallbladder, for example, if I want to treat lateral headache. You see, I change now the plug-in. Again, I push the metal wire forward and can apply my laser needle directly between the hairs on the skull. So I can treat the whole area of the skull and also facial points in this position. So we now show a treatment on different points. First of all, we treat the Shenman point with the red laser. We change the angle according to the structures of the ear. You see, now the point is exactly treated. And now we use the green laser, which is a nice laser because of low depth penetration depth for the ear, and we will now treat with the green laser additionally the thalamus point. We move again the needle to the point. We are very close. Now push the guidance wire forward and move the green plastic back. And now we combine Shenman point with thalamus point, which is a wonderful combination to treat acute and chronic pain. So if you compare the red light on the air with the green light, you see a much bigger spreading of the red light and a much lower spreading of the green light. The reason is that the green light is absorbed, of course, by red blood cells, and the red laser is scattered and reflected by the red blood cells, so there is a bigger spreading. And the big advantage also, if we treat with laser needles instead of metal needles, we not only treat one point, we treat an area.